Okay, hi, we are now live. Thank you for joining us today. This is another Becoming a Doctor F1 tutorial. It's hosted by Dr. Roisin Johnson, and she'll be walking through a Horus Foundation portfolio. So the idea for this session is to be fairly interactive, so any questions, any comments, if you're watching this on Zoom, throw it in the Zoom chat. Dr. Johnson will get to them when appropriate, and same with the Facebook. Just keep the questions and the comments coming, and we'll get to everything when we can. Awesome, off to you, Dr. Johnson.
Thank you. So thank you first of all to Becoming a Doctor for hosting me, and thank you everyone for joining. I hope you're all well. I'm Roisin Johnson. I'm an F2 currently in A&E, and I'm going to be talking to you a little bit about Horus, so the foundation portfolio. So I'm going to move on now to the first slide. So just going over kind of learning objectives, so what I hope you get from this today. So that's what is Horus, as I'm sure most of you have never heard of it before. The foundation curriculum, what's required for your ARCP, and general portfolio tips. So first of all, Horus. So Horus is a computer system used for the foundation portfolio. So throughout your career, you'll have to use different portfolios, and this is just the one for F1s and F2s. It's fairly intuitive and quite easy to use, and it's just a way of kind of documenting everything you've learned and done and evidencing that so you can be signed off at the end of each year. So what does it look like? It's quite an easy to use system. So this is kind of the main page. You can see that it has some kind of drop down menus, so you can look at everything you've done. You can start new forms, and you can see kind of what's waiting to be done. So for example, you can see I've got 2 things waiting to be signed off at the moment. This is just kind of the main page. So this is all the forms that you need to get filled in. These are the mandatory ones. So they make it very clear what you need for each rotation. And you just literally click on the forms and get them signed off. So these are some more of them. And these are just down the bottom. So these are the added extras. So things you need if you're kind of going for a gold star. So I'll move on to the curriculum. I'm just going to check if there's any questions about anything generic to do with Horus. I can't see any questions, so I'm going to move on now to the curriculum. So the curriculum is something that the kind of GMC want you to show and document that you can do in order to be signed off as a doctor. There's actually 4 sections to this. Most of them are fairly easy to be signed off, and you'll do quite easily just doing your normal foundation work. I won't go through all of these individually as they're quite wordy, so feel free to have a look at my slide later. But they're generally kind of easy things that you should be doing anyway. So professional behaviour and trust, communication and team working. So you'll fill these in throughout the form throughout the year that you do. The third section, so clinical care, this is where it becomes a bit more tricky. So there's a couple of things on here that require a bit more work to get signed off. So for example, kind of managing clinically unwell patients does require kind of a lot of input and you being involved in things and getting people to sign you off on things. And I'll talk a little bit about this later. Also, slightly more difficult, safety and quality. So this will be involved in your kind of audit or your quality improvement projects. These do take a lot of time. So be aware of that and start them early. And I'm sure you'll find out a lot more about audits and quality improvement projects when you start. So moving on, just so you can kind of have a look. So this is a little bit of my Foundation 1 page. You can see there my different certificates and things that I've done, people that have signed them, and I'm just showing you this because you need to see map to curriculum. So this is where you evidence everything that you've learned to match with the curriculum. So if you click that little button, map to curriculum, when you've done something, it comes up with a big form like this, and then a drop-down menu, and you can link each one to a different part of the curriculum. And you can see that's done when you get the little kind of blue book sign here that looks like this. You can link more than one thing to different pieces of the curriculum, so don't be afraid to do that. So if you've done something wonderful, link it to everything. The only thing I will say is that you end up with a page like this. So for each of those different points, I had evidence like this. It becomes quite long. So my first trust that I was in said link everything and document everything. The only thing that's changed slightly this year is they've said kind of link your 5 best pieces so they don't have to sift through all this information. This might change again, so I think it's probably worth asking when you start how much evidence they want for each point, just so you know. You can also see I did this quite late. I personally found it easier to link it all at the end so I could show kind of where I was missing things and I could fill things in quickly at the end. But some people like to link things throughout the year. So it's kind of personal preference and what suits you the best. And then just something I learned when I was doing this PowerPoint, there's a little tiny button at the top there, e-learning for health, which is actually really useful. So when you go on your curriculum, if you click that button, you can see kind of here, it drops down all different hyperlinks to e-learnings you can do to fill it. So I wish I'd known that earlier. It would have been a lot easier to fill things out. But if you have gaps, use e-learning to fill them, which would be kind of a handy alternative than having to chase people around for signatures. Perfect. So I'm just going to stop again for a second just to see if there's any questions. I can't see any at the moment. I'll give you 1 second to kind of give some questions if you have any about that. I know it's quite wordy. So I'm going to move on now to kind of ARCP. So this is again probably something that you've never heard of, and it's your annual review of competency progression. So this is something that happens every year for foundation doctors in about June, in order to sign you off to say that you're safe to keep working and you've met the basic competencies for everything. It's quite a stressful process, but it normally goes really well. People are very nice to you and want to help you. Generally in F1, you don't attend this meeting, so it's 3 consultants at a panel look at your kind of online portfolio and decide whether you pass or you don't. I think in F2, normally it can be a face-to-face thing, but this year due to COVID, I think we're doing it online, so it won't be face-to-face. But it's much less daunting when it's done, and it's really nice to get the feedback. So what's needed? Things differ between whenever you're an F1 or an F2. They're generally the same, and there's quite a lot of stuff here that you can read, and you'll be bored to death being told all this stuff in F1. So I'll just go over the kind of differences. So in F1, you have 15 core procedures that need to be signed off. You have to do these. So in F2, you don't have to do them because you've already been signed off. The mandatory certificates change between the 2 years as well. So as an F1, you will have to have passed the prescribing safety assessment, so the PSA. Most of you will already have had this, so that's good. And you also should at least achieve ILS to intermediate life support, although you need ALS, so advanced life support for F2. So most people actually do ALS in F1, so then it counts for both years. It lasts for 4 years, so you're signed off for both of them, and it looks quite good as an F1 to have this. I would also say, just from kind of a doctor's point of view, it's really nice to have ALS. I unfortunately did it at the end of F1, and it would have made me feel a lot more confident attending crash courses if I'd kind of had more advanced knowledge of what I was actually doing. And then the only other difference is to do with kind of audits and quality improvement projects. So as an F1, you just have to show that you were involved in something. There'll be hundreds of audits and quality improvement projects offered to you when you start. Try and pick something easy. They're not looking for anything kind of world-changing. Do something that you can do kind of in a quick time, and that's easy to do. It's also good if you do a quality improvement project. So that's when you kind of close the loop on an audit, so you redo it. So I actually did a quality improvement project as an F1, which is now counted to F2, so I don't have to redo it, which is really nice, not having to do extra work. So think about that. I think I have a question, so I'm just going to have a quick look. So going on now to each individual form. So the mini CACs, so this is a mini clinical evaluation. So you need to have kind of a minimum of 6 of these each year. And they're kind of somebody observing you doing something clinical. So it can be from taking a history to performing a procedure or doing a skill, anything that you would normally do. I found these okay to get. Some consultants like you to tell them beforehand that that's what you're looking for. But in my general experience, I would do something and then just say to the consultant, can I have a mini CAC for that? They're normally really happy to help you. I think the easiest thing to do is to spread them out between your rotations, to try to get kind of 2 or 3 in each rotation. And you can see the generic form here. So you just give a little title kind of what happened. Then again, you just fill in a little bit. So it has to be anonymized. So just for example, I would say kind of a 62-year-old male had this and this happened. Then you just tick where it happened, what you're kind of showing. So again, this like links to your curriculum. So you could tick, you know, circulation and breathing, and then you can link that to your critically ill patient. And then you need to just tick what the focus of this was. So were you taking in history, were you examining, and that kind of thing. Then the assessor can put in their feedback, and you should always write a little reflection. Just as a hint, when I do these forms, I normally discuss it with the consultant first, so I have my feedback, but then I'll type my own feedback and agreed action going forward. This just makes your life a bit easier, and it makes them more likely to sign it because they just have to tick a box. One of the other mandatory forms is case-based discussion. So this is a little bit different to the mini-KEC. So rather than a clinical thing, it's you talking through a case. It's basically the same form. It's just that you're kind of discussing where the problem that you discussed fell, and then kind of where the focus of your discussion afterwards was. I actually found it easier to try and get these together. So for example, as I've been in A&E, I would do things like a primary survey, and the consultant would watch me do that as my mini-KEC. And then we talk through kind of the management of the patient afterwards, and I get that as a CBD. So you can kind of get them together, which will save you a lot of time. And you do have to fill in 2 forms, but it makes life a bit easier. And then docs. So docs kind of add into your mini-KEC forms. So they generally say that you can add, well, you can have about 3 a year of docs. There's somebody watching you do a procedure. So you can see here kind of the things that they're looking at. Most of these are quite difficult to get for an F1. I think in the end, I ended up getting things like difficult catheters or using silver nitrate to cauterize something. It wasn't anything glamorous like doing a drain. Basically anything that you can get put here. I don't think anyone would be picky as long as it's not one of the core procedures. And talking of the core procedures, I'll go on just to tell you a bit about them. So there's 15 here. I don't need to go through them all. Most of them will be your bread and butter and things that you do all day, every day. Some of them are a little bit harder to get than others. And I would just say, remember that band 5 nurses and above can sign you off on things. So I think we ended up going round on the Delta-Parin round with the nurses at 5 p.m. to get injections signed off. So just bear that in mind. Doctors don't always do these things, so anyone can sign you off. They generally have to be above an F2 though, which is more difficult to get. The other thing I would say is the airway care and simple adjuncts. This is the thing that people found the hardest to get signed off, so I try and actively go out for this one first. Generally as an F1, you won't really be involved in airway care of patients, even in kind of crash calls and things, unless you're in a very small hospital. So I ended up doing this, talking through airway adjuncts with my registrar, and he was happy to sign me off from that. And I know some of my friends and colleagues got it signed off doing ILS or ALS courses. They just asked in that. So bear that in mind if you're doing those courses, ask them up front if they're happy to sign you off, if you can show that you can use airway adjuncts and make friends with the nurses. Just to show you, as I've shown you all the other forms, this is the form that pops up from core procedures. So you can select from a drop-down list, kind of one of the 15, and then someone just fills in some comments about you. So it's a smaller form, it's less for you to do. You don't have to reflect on the core procedures like you do the others. So it's more of like a generic tick box form. So I'll move on now to the tab, so the team assessment behaviour. So this is something that you have to do both years. You have to, generally it's within the first kind of rotation you do towards the end of it. And you need to get 10 people to fill in a feedback form on you. This is actually surprisingly difficult to get. On the side, you can see kind of the breakdown of things you must at least have, and you can only have 2 F1s included in this. My advice to you would be send it off early. So I went round as soon as it opened, everybody that I knew that would fill it in and just ask for their email. Once you send the first request for feedback, you have 90 days to fill it in. So it does take a lot of time. You can send them reminders, as some people aren't that great at filling it in. And I would just say ask more than the necessary people. You can fail your tab. So if you run out of time, or if somebody puts that they have a concern about you, you will fail your tab and you'll have to redo it in your next placement. You're allowed to do that, and you're allowed to do that twice. So you have 3 kind of ways to do your tab in each rotation. So you can do it once in each. And just there's sometimes rotations where you're not able to do it. So for example, if you're in a GP placement, there's generally not 10 other staff members there. So they know that, and they let you just do it in your next rotation. And these are the kind of questions that people are asked about you. It's actually really nice getting the feedback. Everyone's really nice about you. And it's generally kind of a great tool to see how you're doing and other people perceive you, as it might be a little bit different to how you think you're doing. And now, so I'll just go through a bit about the supervisors that you have. So there's 2 different types of supervisors. There's the overall foundation program director, who don't really have too much to do. They're involved in kind of your well-being, teaching and things like that. So you'll know them, but they don't do any forms for you on Horus. And the 2 supervisors that do are your educational supervisor and your clinical supervisor. So just to go through these, your educational supervisor is assigned for the whole year. So they're generally someone who you will be working with. It's generally a consultant that you know. You might not always. So I've had some colleagues who've not known who their supervisor is, or never actually met them before. And they've been kind of involved. You just meet them a couple of times a year. So you meet them initially at the beginning of the year, and you complete your first rotation form and your education supervisor form, and then you meet them at the beginning and end of each rotation. And they actually are the ones that sign you off as satisfactory or not at the end of the year. So they're quite important to you. And I've generally found them to be really helpful. They've helped me with any problems that I've had, and just kind of look after you. Then you have your clinical supervisor, who's assigned to you for each rotation. So they're normally kind of a consultant in the specialty you're working in. I personally have had an education supervisor who was also my clinical supervisor, was that when I was on their kind of job. And they do your beginning and end of rotation forms. So slightly important, but slightly less kind of scary than signing off at the end of the year. I'm just going to pause there, as I got a couple of questions. Let me just have a look at those. So one of the questions is, what is a mini CACS? So sorry, I wasn't very clear on that. So it's a mini clinical evaluation form. I'll just go back to that slide. So it looks like this. So it can be anything from you taking a history to you examining a patient, so doing an abdominal exam on a patient. Anything that's clinical can count as a mini CACS. I hope that answers it a bit more. So normally, kind of if you're doing a ward round, a consultant will say to you, can you examine this patient? So examine them, and then just say after that, can I have a mini CACS? So one of the ones I got, I think I mentioned it earlier, was a primary survey of a patient. So a trauma patient came in, and the consultant said to me, do the primary survey. So I did this, which is something that you'll learn to do when you're in A&E. So it's just a basic assessment, A to E assessment of the patient. And then I just filled in this form to say kind of 50-year-old man, trauma patient, and the consultant filled in the feedback. The other question is, would we need to complete 10 tabs per rotation over the course of the year? So the tab will need to be completed within one rotation. So when you start your tab, you can choose to start it in any rotation, but most people do it in the first one just to be safe. You send out 10 tickets, or more than 10 tickets they're called, but they're just emails inviting people to fill in your feedback. But it has to be completed from one rotation and within 90 days. So the other questions on supervisors. So do you have different clinical supervisors for each rotation? So yes. So for each rotation, you'll get a different supervisor. The only slight change is that one of your clinical supervisors can also be your educational supervisor. So for example, last year, my first job was on surgery. So my educational supervisor for the whole year was also my clinical supervisor for that rotation. And then my next rotation, my clinical supervisor changed, but my educational supervisor stayed the same. Next question is, can the mini CACS be accessed and filled out on your phone? So yes, it can, which is really handy. I can do them on the wards and things like that. Sometimes when I'm commuting, I can fill them out because it's anonymized data. So you can do them anywhere. Horus can just be accessed from Google. So it can be done anywhere you need to. And the other one is, can you get your tab completed at the SIY1s? So I'm not sure about this. I'm guessing if you're on a proper rotation, they'll let you know. The foundation year 1 doctors normally do it towards the end of their rotation. So they send an email out to all of us saying the tab is now open for you to get it signed off. So I'm sure if you can fill it in, they'll send you this email off as soon as they can. And then there's a couple of other questions. So I'll just go through these quickly. So is it possible to get the slides of course? I'll make sure they're accessible for you. Minimum level that supervisor has to be to sign you off doctor-wise. So it depends on kind of what you're getting signed off. So in your tab, you can have 2 F1s in there. Some of the core procedures can be signed off by an F2 or above, which is really handy as you'll normally be with an F2 on the wards. The mini CACs, CBDs and DOPs need to be signed off by someone more senior than an F2. So that's the difference there. So I'm going to move on now just to the next bit. So teaching. So teaching is a bit of a controversial subject. It's recently changed. So in my F1 year, we had to attend 70% of all teaching that was put on for us, which this year has changed to 60 hours a year. So 60 hours in F1 and 60 hours in F2. This is broken up by 30 hours must be core teaching. So this is kind of foundation teaching sessions. So I think this will be decided by your foundation school. So my particular foundation school decided that foundation core teaching will be made up of our foundation teaching, which is we have 1 hour a week by a consultant or somebody from the hospital giving us a lecture. And then we have another hour of peer teaching, which is other F1 doctors teaching each other. And we must have 30 hours of non-core teaching. So this is can come from anything from grand rounds to departmental teaching, e-learning and some courses. So unfortunately, ILS and ALS aren't included in the courses as you'll have to do them anyway. And e-learning can only make up a certain proportion of your teaching. I'm not sure the exact value, but they'll be able to tell you that. Then reflections. So reflections are really useful to help you with your learning. 1 second, sorry, I was going to turn something off. Sorry, that's the noise in the background. So reflections are really useful to help you with your learning. I think they're good because they allow you to kind of think about what went right and what went wrong and how you can become a better doctor from that. Some foundation schools only accept public reflections. So I've actually changed foundation schools. And so the one I was in for F1 accepted secret reflections. So these are ones that other people can access. Whereas where I am now, actually stipulate that they want 3 reflections per year and they all have to, per rotation, sorry, and they all have to be public, so able to access by the people looking at your portfolio. Reflections are useful because they can fill out areas of your curriculum that you're missing. So for some reason it might be hard for you to get some things, but you could reflect on, for example, end of life care is a good one. So sometimes it's hard to get involved, but you could reflect on seeing a patient dying or something like that to fill in your curriculum. And you can, and most people are worried about this, but you can say things that have gone wrong. It shows that you're caring and you're willing to learn and that you know that you can become better. So I'm just going to go through a couple of extra things that aren't kind of the main forms, but you need to think about getting signed off. So one of them is developing a clinical teacher. So this is just one form that you have to get signed off each year, showing that you're thinking about teaching. They're slightly difficult to get as such an abstract form. It's just you filling in kind of what you did, what you think went well from the teaching session, and someone giving you feedback of how you can improve. I think I actually got it signed off in the first year for one teaching session I did to some medical students, and then this year I was involved in a journal club and I did one presentation and got it signed off. So don't get too worried about that. Extra teaching sessions, so I'm sure there'll be lots of medical students around. They really enjoy doing bedside teaching sessions or just hearing what it's like to be an F1. So I think it's a great idea to get involved with that. If you see them around, teach them, they'll be willing, and it looks really good on your Horus portfolio and your portfolio going forward that you've been involved with teaching. Form R, so this is just a form you fill in at the end of each year, just to say that you feel that you've fulfilled the criteria of the curriculum and that you're happy to proceed as a doctor. And I think you just have to put on how many days you've been absent from the year. It's nothing to worry about, it's just a mandatory kind of form that you have to fill in. The same as the GMC survey. So each year you get a link to the GMC survey, normally in your second rotation, to say how you feel your placement's gone, what's good, what's bad. And when you complete this, you get a number that you put into Horus to say that you've completed it. Mandatory certificates I've kind of gone through already. So this is your ALS, ILS, and PSA. You just upload the certificates into Horus and make sure that somebody accepts them and approves them. Normally your educational supervisor will do that automatically. One other thing that's not mandatory, but it's good to do, is a personal development plan. So you'll see when you log on to Horus that there's a button for this. This year I've tried to use it a bit more. So with my educational supervisor at the beginning of the year, I set out what I wanted to achieve this year. So for me, I want to do surgery. So we kind of talked about how I'd get to theatre or do more suturing. And then you can also set with each of your, I think that each rotation now, you can do development plan for that rotation. So for A&E, I wanted to get involved in research more. And then at the end of the rotation, you can personally decide if you met
and if you completed them. And then you can just put, you know, I completed this, and it evidences kind of that you learn and that you set yourself goals and you achieve them, which is really good. And then again, just to reinforce it to you, you evidence everything you put on there via linking to the curriculum. And then this is just kind of a form showing you the additional forms that come up on the thing. So leader, I think this is a new form, they're bringing it out next year, so we haven't actually used that. Teaching others, so if you run a teaching session of medical students, log it on here. It's good for you so you can remember when you did it, and then it's good just to show that you've been involved. Taster, so I think most foundation schools allow between 1 to 2 weeks for you to do a taster week. This is a chance for you to work in a specialty that you necessarily didn't get a rotation in, but you're kind of interested in. It's a really good opportunity, and then you just fill in this form afterwards to show that you've done it, and it looks good as well for specialty application to show that you've shown an interest. They don't mind too much if you didn't have a job in something, as long as you get a taster week to show that you're kind of committed to it. Research, so this is if you've done any research or publications. Procedure, non-core, I didn't really use this, I use these as DOPS, so I never use this form. Interesting cases, I think I use this once or twice just to remind myself of interesting things I'd seen. And then any extracurricular achievements you make, any exams you do, and then other learning attended. I use this quite a lot when we just had percentage of teaching attended to show that I kept going to the surgical meetings. And then this is the personal development plan. So completely up to you if you fill it in or not, and the career planning again is up to you. So I'm just going to have a look for the questions now. I think there's a couple there. So there's, what does linking to the curriculum mean? I think this was covered at the beginning of the slides, but there's 4 different sections that you have to meet with different points. And when you submit a form onto Horus, you can then click a button to show which, to evidence which part of the curriculum what you've done kind of shows. And then what happens if you can't achieve your goal for PDP, so for whatever reason. So actually, I think this is quite typical at the moment. So lots of my PDPs were on kind of getting to theatre and suturing and things like that, which I've been unable to do with kind of coronavirus going on. And so I'm just going to put that I tried my best. I wasn't able to do it as an optional form. So there's no negative consequences of not being able to do it. But I think it showed that you tried to set up a goal and for whatever reason you can't achieve it. So that's not a problem. So general kind of things now. So my tips going forward would be, to stay up to date. So with hindsight, I wish I'd kind of kept a bit on top of my portfolio. It's quite hard to remember everything that happened after you did it. So normally I would say try kind of maybe once a week to go on it and just put anything that happened that week. Submit more than you need. So it's quite difficult again to get people to sign forms off. So if you've only done the bare minimum and you're waiting on signatures at the end of the year, these forms won't count. So it's better if you kind of do more than you need and know that you're safe, and any extra is kind of brownie points rather than being kind of short of things. being nice. So I know this is a bit generic and everyone says it, but being nice actually really helps, especially with things like your tab. If you're nice to people, they're more likely to give you good feedback and just fill in your forms. Fill in your own feedback. So I went through this a little bit. So when you're doing the mini-KECs or CBGs, there's a box for your kind of assessor to fill in feedback. People are happy to do this themselves, but often they have lots of requests and kind of forget little things that happened. So I normally kind of write the feedback that they gave me on the spot in this box, and they're free to edit it, but it makes them more likely to fill it in, and it gets your form signed quicker. Reflections, so reflections are your friend. Use them to fill the curriculum, use them to make you a better doctor, and just use them to show people that you care and you want to learn. So one of the points I would say is be warned that your last rotation is shorter. So ARCPs normally happen in June. You will go on to your last rotation in April. So this leaves you for your last rotation 2 months to get everything signed off. So in my F1, we were told we had to split the forms between each rotation. You actually are allowed to carry some of them over. So I'd say from the first 2 rotations, try and front load a bit and get more signed off at the start. And then you can kind of relax a little bit for your last rotation, just get the last couple of things signed off. E-learning, so again, e-learning is a great tool just to fill in things. It's all absolutely free online, as long as you do the e-learning for healthcare. You can use it to fill your curriculum, and it just shows that you kind of are willing to learn, which again is another curriculum point. And no patient identifiable data. Each form says this, but I think because it's not a secured kind of website, that you can't put anything that anyone could be identified on. If you do, it can be removed, and I think you can be reported to the GMC, so I'm sure you won't forget. It says it on every form, but just don't put anything in there. And then just to show you here, there's a really handy button that I've only seen recently, download portfolio. So when you're going for specialty interviews, you can take bits of your portfolio with you to show as it's been signed off by somebody else. So that's a good button to have. So I'm just going to go to the questions now before takeaway messages. So best tip for staying on top is just keep going, maybe set aside a time once a week to go through everything and just make sure it's all done. I'm not sure if the new FY1s have access to the EAT portfolio. We only got it when we started in F1. I'm sure if you ask, they can add you, as I know people who actually aren't in the foundation program can get access to it. So maybe you can start early. I'm sure if you speak to someone in the hospital, they'll be able to let you know. An e-learning module, which e-learning modules do we have to complete? So this varies. So I was initially in South Thames, where when we started, we had a huge set of e-learning resources that we had to complete. In my new trust, actually, it's changed a bit, and we just have to complete the mandatory training. So it depends on where you are, but you can always do more than they need. Sorry, let me just go back a bit. And there's one other question. Oh, and somebody's just said that they do have access to Horus. So there you go. And then, so my takeaway messages, enjoy your time as a foundation doctor. It's really nice. You'll meet some great people and get great friends. It's quite nice having less responsibility, although when you first start, it feels like it's a lot. Get started early, so kind of fill in anything that you can as soon as you can. I left it a bit late because I wasn't really sure what I was doing, but don't be scared. People will help you, so just ask someone if you're not sure. Keep on top of getting things signed. So again, you can send reminders out to people to get things signed off. So just keep sending reminders or keep asking them to sign them. But if that's not working, send more than you need to make sure that you don't have any problems getting things signed off by the end of the year. And use your reflections and e-learnings to fill gaps. So anything that you're missing, you can always use those. So thank you, everyone. That was all the slides I had. Has anyone got any questions about anything? So one of the questions from Facebook was, what happens if your educational supervisor and your clinical supervisor are not signing forms or unable to contact them? So I'm actually having this problem at the moment. So unfortunately, my clinical supervisor has been moved to a different site and he's a little bit hard to contact. I've just let people know that I'm having this difficulty. the sooner you let them know, the sooner they can sort the problem. So there are things you can do. So if you speak to the foundation program director, they can always change your supervisor. Generally, they have been signed off in teaching, so they're really good at getting back to you and approaching you to get things done. So I wouldn't worry too much about it. If it's not your fault, just let people know early and they'll help you with that. Just wait a minute or two more to see if there's any more questions. And sorry, just to be clear on the tab, so it's, you need to get 10 responses for your tab. So you do 1 tab a year in one of your rotations, normally your first rotation. And from that tab, you need to get a minimum of 10 responses back in order to complete the tab for the year. And what happens if you fail your portfolio? So I don't think this actually happens very much. Normally what happens, and I know it happened to a couple of my colleagues, is that everything wasn't done in time. So for example, they didn't have everything signed off, or they hadn't attended enough teaching. There's a bit of an unofficial kind of deadline to it. So if you don't get past your first ARCP, they'll give you the things that you need to complete to pass. And then a couple of weeks later, they'll reassess your portfolio to see if you've met all these things. I don't know anyone that had to have kind of consequences after this. Everyone managed to get it signed off. So I wouldn't worry too much about that. Normally it's quite easy to get things signed off and people are really happy to help you. So thank you everyone for listening. I think that might be all the questions that we have. I hope that was helpful. I'm sure you'll get used to it when you start using, oh, sorry, there's more questions now. How do you give evidence of an audit? So there's actually a little audit button somewhere in Horus. You can link, so I ended up, I think, linking the slides that I used for my presentation in the audit meeting and the poster that I made for a conference onto Horus, and they accepted that as evidence. So what has to be done per rotation and what has to be done over the whole year? So I don't want to give you too much information on this because I think it can change depending on which foundation school you're in. Normally per rotation will just be the initial and ending meetings with your educational supervisor and your clinical supervisor. Everything else you then have kind of the year to fill out. Some foundation schools like things to be done per rotation. So for example, South Thames last year wanted us to have kind of, I think it was 2 mini-KEPs and 1 DOPS and 3 CBDs per rotation. Although they did allow us in the end to carry some over. Whereas this year I'm in Wessex and they're much more happy for us to just kind of fill things out where we can throughout the year. The only thing that has to be done in one rotation is the tab. So again, that's up to you which rotation that you do it in, but generally it's the first rotation, but it doesn't have to be done there. And then can any audit or QI project be done in med school used as evidence? So I think you can't use that as evidence because you didn't do it when you were a foundation doctor. That will look great on your portfolio for specialty training, so don't forget that you've got that, but it can't be used for this. So that seems to be all the questions. I hope, thank you everyone for listening. I hope that was helpful. You'll get the hang of using it. It's very easy, and all the best for F1. Enjoy it.
Okay, perfect. Thank you, Dr. Johnson, for hosting that. For everyone watching, the slides will be available on our Becoming a Doctor website, and the video will be available on Facebook and our website within a few days. So just watch this space. Thank you, Dr. Johnson, and have a good evening, everyone.